So now you have a diagnosis of CGD or a potential diagnosis of CGD, and you're wondering if you aren't yourself an immunology expert, what specialists should you consider talking to? Well, if you're a general physician, I would first start with your local expert in immunology, who often will know a great deal about CGD and other inherited immune deficiencies. Particularly with CGD, it would be important to connect up with an infectious disease expert to guide you in the kind of antibiotics that you might need to use to treat specialized infections in CGD patients. Particularly if you have a patient who has a fungal infection, this is specialty stuff, and you really want to talk to your infectious disease expert about exactly the kind of antifungal you want to use, how long to treat, how to follow this, how to get the infection fixed, but avoid toxicities. It may also help if the patient with CGD presents with or later develops inflammatory bowel disease. You may want to engage a gastrointestinal expert. Now, you don't necessarily need to do that, but it's interesting. Many patients may not present initially with gastrointestinal problems, but it might be worth nonetheless connecting up with a gastroenterologist to sort of ask the right questions and see if maybe this patient that you have might have early signs of gastrointestinal problems, and it might be good to pick those up early. So there was a time when CGD was very rare. People did not know much about the disease. It was first recognized in the 1950s and 60s when it was realized that what the nature of the disease was. And at the time, interestingly, it was called fatal chronic granulomatous disease of childhood. And there were only a few centers around the country. There were specialized places like Paul Quay in Minnesota and Dick Root and others at NIH in that era, John Gallen. And if you had CGD, you'd want to go to one of those centers, and that's where you'd want to get the advice. But there are now many centers around the country that know about CGD, and if you're a GP in a small community somewhere and you've made the diagnosis, you want to seek out your local major center where you have an expert. But I can promise you there are experts in all the states and in some states in several centers who really know about CGD and can help guide you without having to send your patient far away to get the kind of care that's needed to properly manage CGD.